Good afternoon. I'm Erica Tarantel. All day long, we're focused on mental health and well-being. So many people have expressed a need for support, especially during the coronavirus pandemic. And experts believe that need will continue for years, even as we ease into a new normal. In fact, researchers say healthcare providers working during infectious disease outbreaks have experienced mental health distress up to 3 years later. And joining us now to talk about all of this, a very important issue, is Donna Mosh, President and CEO of the Massachusetts Association for Mental Health. So Donna, thank you for being here.
Thank you so much for having me. I really appreciate your interest and Channel 5's interest in this issue. Really critical for all of us as we recover from the pandemic.
Well, and I know you and your team, you're working with lawmakers to change what mental health care looks like in our state. So what are some of the changes that are in the works and that we need?
Well, there's some very exciting changes, and I can't emphasize enough how fortunate we all are to live in the Commonwealth of Massachusetts, where we have leaders in the legislature and leaders in the administration and in the judiciary who are really determined to reform things. Including a roadmap for reform of ambulatory behavioral health services that will establish a new front door to the system where you can call or text 24/7 to get assistance with accessing care and with immediate assessment. Building up our community behavioral health centers so they can respond timely in a crisis, and implementing a range of services, including urgent care that would keep people away from unnecessary trips to emergency rooms or engagement with the police. Creating a restoration center in Middlesex County as a first step to looking statewide at more diversion services from arrest or emergency room intervention during a crisis. We're really excited to see this expansion of services in the Commonwealth, and also to try to solve the emergency department boarding crisis in the state with opening up new child and adolescent and adult psychiatric beds geographically dispersed across the Commonwealth.
Yeah, there just aren't enough beds for all of the people in need. We know that. When can we expect to see some of these changes?
Well, some of the first beds are actually coming online in the next few months. The administration put out both dollars and removed barriers, regulatory barriers to opening new beds, and half a dozen organizations, hospitals around the state have responded and are in the process of opening and planning to, within the next year, open additional beds.
And you have a new campaign, so let me ask you about Just Ask. Tell us who you're trying to reach.
So the Just Ask campaign is designed to reach youth and young adults. We found during COVID that they were disproportionately impacted by the traumatic stress, reported higher levels of anxiety and depression, with really close to 60% reporting changes in their mental health status as compared to 41% of other adults. And we know that you can't always be looking for access to an outpatient treatment situation, but you can rely on friends and family and others in your life if you just ask.
Yeah, just reach out. Yes, we're running out of time. Donna Mosh, thank you so much for your important work. We do want to mention for those listening, if you or someone you know needs to be connected to mental health services, just call 211. Operators there can help. Much more through the afternoon.